There's plenty of horror stories being told. All of them are untrue. But in those tales, turned out to be just that, tales. Stories made up from whole cloth. Lies distorted by the Republicans to grab headlines or make political advertising.
Wow. That's Senate Majority Leader Harry Reid, you know, the guy whose nose gets longer every time he opens his mouth, calling Americans who've lost insurance because of Obamacare liars. Of course, you remember him. He's the one who refused to pass a funding bill that would allow young cancer patients to continue their treatment during the government shutdown, questioning why funding should be provided to help, quote, one child who has cancer. And then he attacks a reporter as irresponsible and reckless for calling him out on it. And Harry, you call us liars? All the medical nightmares are untrue, all brought about by Republicans and their political agendas? I have news for you. Not one Republican voted for you or Obamacare, and you still want to blame us. Senator, do you ever take off your political hat and think about people as human beings, not Republicans or Democrats, like the 17-year-old girl with malformations on her brain about to have her 90th surgery who lost insurance because of you? Now, she's the liar, too? Her mom now demanding that you put your money where your mouth is and apologize to her and the American people. Harry, time to take off those rose-colored glasses and start looking at people as human beings and not as your political enemies. With me now, practicing physician and former senior policy advisor to the Centers for Medicare and Medicaid Services, Dr. Scott Gottlieb, and author of Beating Obamacare 2014, Betsy McCaughey. All right, doctor, are these stories all made up like Senator Reid said?
No, it's an unfortunate remark. There are a lot of dislocations in the market right now where people are finding they thought they were insured and they're not insured, or they got new insurance through Obamacare, but they can't get access to the doctors that they used to have or the drugs that they need. These plans are very bare-bone plans. Even the healthcare insurers are calling them Medicaid Plus.
All right, and both of you now, let's take a listen to something else that Harry Reid said.
For years, Jane was locked into her job as a school teacher because she, Brett, and their 2 teenage children needed guaranteed health insurance. It cost a lot. But Jane was able to quit her teaching job, spend more time with her children, and help her husband at the family small business. Jane says the Affordable Care Act has literally changed her life and the lives of her loved ones.
All right, Betsy, without even getting into whether being locked down in teaching is a bad thing, is this administration against work?
They seem to be against work, but they're certainly not for the truth. And I want to underscore the point that he made before about liars, because the people he is calling liars are actually people with pre-existing conditions, the very people that the president and his party claimed to be protecting. These are people who had health insurance, as most people with pre-existing conditions did. They lost it. They were forced onto these Obamacare exchange plans where they no longer have access to the doctors, the hospitals, and the medications they came to rely on. I talked to a doctor this morning who treats MS patients, Dr. Jeff English, and he told me that many of his patients are deteriorating because the exchange plans refuse to pay for 6 out of 10 of the MS medications that those patients need to stave off the disease.
And, Doctor, you're nodding your head here.
Yeah, that's what we're seeing. I mean, the regulations made these plans so expensive that what the insurers did is they went after the only thing they could, the government let them do, which is the networks of physicians and the drug formularies. And so what you're seeing is networks that are very narrow. People can't see a lot of doctors. And the lists of drugs you can get access to are very small. These are closed formularies, which means if your drug isn't on that list, you're completely out of pocket. You're on your own. And we also look at MS drugs. They're missing a lot of key drugs.
Costs $6,000 a month.
A month?
Yes, and Dr. English told me about a 20-year-old nursing student who had to quit nursing school because her health status was deteriorating so rapidly she could no longer get the drugs she needed.
And the key to remember is the money you spend on that won't count against your deductible or your out-of-pocket maximum, so you're completely on your own. That's the nature of a closed formulary. Most consumers aren't going to be used to that because that's not what prevails in the existing commercial market.
You know,
Senator Reid, where's your compassion?
Yeah, but you don't expect it from him when he said what he did about the child with cancer. But you make such a good point. I mean, they were like, you know, you keep your doctor, the president said, and I'm not going to go over that. But it was supposedly, America, we should be happy now. If you have a pre-existing illness, you're covered. And what we're finding is, like I found on this show, a woman who's in the middle of her cancer treatment, her chemo, she couldn't continue to go to her doctor.
Patients with pre-existing conditions and seniors are the two groups clobbered by this Obama health law.
Those are the drugs typically missing from these formularies, are specialty drugs.
All right, guys, let's take a listen to what the president said to his political action arm.
We're going to make a big push these last few weeks. But as I said, I can talk. My team can talk here in Washington. It's not going to make as much of a difference as if you are out there making the case. The work you're doing, is God's work. It is hard work.
Okay, the Little Sisters of the Poor aren't doing God's work, and the Justice Department is going after them. But Obama's volunteers, a part of his political arm, are doing God's work. Is he kidding? I mean, what do you think about that, Doctor? I'll go to you first.
Well, look, people aren't signing up for these plans because they're not most consumers. These were plans designed in Washington, not in the marketplace. So they don't do what consumers want, which is give them access to doctors, give them access to the drugs they need. They're very expensive and they're very tight plans. So that's why they're not getting people to enroll. They blame it on the fact that they haven't had outreach, but people looked at this and they don't enroll.
What do you think of that comment?
And now seniors are the next to really feel the pain. We've already seen the cuts to Medicare Advantage. Many seniors are losing the doctors they've depended on because the cuts to Medicare Advantage plans are translated into fewer and fewer doctors available to seniors.
All right, and how many more Americans are going to lose their insurance?
About 25 million more, as small group plans are not renewed and employers say, I can't afford this Obamacare plan that's mandated. I'll send you to the exchanges.
That'll happen this fall, too, right before the election, because all the small group plans were grandfathered in for another year. This fall, that grandfathering's up, so those are going to get dropped, those plans.
And how will it affect business?
Well, it's going to make the small businesses are either going to have to pay much more money or put their employees into Obamacare. The administration might do something to push this off because they won't want this to happen around the time of the election.
Scott's smiling as he says that. One more change to Obamacare. Why not?
Yeah. Well, hey, you know what? With the executive orders, he can just change it at will, which is what we've seen. Anyway, do Americans have any? What are their options who've lost their insurance? Do they have options?
Well, unfortunately, Obamacare is a bad deal for most people who have lost their coverage, and especially people who are going to lose on-the-job coverage. They're going to find when they go to the Obamacare exchange plans, the premiums are higher. They're paying with after-tax dollars, huge deductibles, and for all of that extra money, they can't even use the doctor and hospital they came to rely on.
That's so sad. All right, Dr. Gottlieb.